Good afternoon. Welcome to the Effie Berry Training Institute. Today, we'll be discussing narrative reporting for regional early intervention services. My name is Dr. Tamara A. Henry. I am a teaching associate professor at the Milken Institute School of Public Health at the George Washington University. So glad to have you guys back again. When we discuss narrative reporting, it's really providing the funder as well as your project officer with your time to shine. This program is funded wholly or in part by the government of the District of Columbia, DC Health and HOSTA. In our learning objectives today, we're going to utilize the narrative to tell your organizational story. Again, your time to highlight what worked well or what didn't work as well in your program planning and your program execution. We're going to identify components of the narrative and who should contribute to the various components. And we're going to articulate the importance of lessons learned, dissemination, and sustainability in program planning and management. But before we get into the actual narrative reporting, I think that one of the first things that we want to do is go back and review the original proposal. In your original proposal, there were several different documents required to make things go forward. So the first was your cover page that had your granting organization, program, proposal title, etc. Next, you had an abstract that was typically a summary of what your proposal said. The introduction provided your reader with the historical context as well as a review of the literature and how these relate to your current project. The problem and or opportunity, why is this project needed, and how do we plan to go about resolving this problem? Your SMART objectives and your goal, who will be changed by your program proposition, as well as how. What do we expect to gain or receive as a result of your program? Method and activities. How are you going to accomplish these goals that you have written about, that you have demonstrated in the document? How will you accomplish those goals? What are some of the challenges that you anticipate, and how will you address them? So in your proposal, you mentioned there may be some barriers to collecting particular types of data or reaching your focus population. So remember to go back to that when you consider how you're discussing your narrative. The evaluation, we just had our former discussion on evaluation and the importance of accountability to your funder. Assessing your plan. How do you know that you've accomplished the goal? Did you stick to the plan? Are you in line and moving in the direction that you hoped to move in? Personnel, the people who will be involved in this endeavor. Who are they? What is their job description? And you most likely put forth a resume or CV in the entire package. Timeline. What's the estimated timeline for grant activities? Your results and significance. What happened as a result of your intervention? Your budget. You typically include a budget as well as a budget narrative explaining and detailing how each item will be spent going forward in your project. And if allowed, you have an appendices that may include a logic model, previously published articles by your organization, related data, and other CVs as needed. So some of the questions that you want to consider is who contributed to the original proposal? Who are the people that wrote this? Are the people that wrote the proposal still in the organization? Because we're going to need them now to assist with our narrative. Did one person manage the grant from start to finish? Because if one person managed the grant from start to finish and another person wrote it, again, we need to have those people at the table so that we can discuss all of these items and really get a handle of how we want our story to be portrayed in our narrative. Who collected the data? Did we have an external evaluator, or did we have someone in-house collect the data on a regular basis? Did we have that individual monitoring the data as well as collecting the data? Who collected it? And then who managed the fiscal reporting? Who was the person that reported to your funder on a regular basis, quarterly oftentimes, where the money was, if you were drawing down money in an appropriate manner, all of those things. Who managed the fiscal reporting for your grants? So there are two main types of narratives. At the university level, we typically use research reports. Those are the narratives that we focus on. They really hone in on the results of the research. It compares the current results with the previous results. They're published in peer-reviewed journal articles and contribute to the overall body of knowledge related to that specific topic. They're almost always written for a generalized audience within a wide field of studies. For those of you who have read the American Journal of Public Health, you'll note that there are several different topics for all different kinds of people in that journal. So it's not specific to an agency or field. It's very general as it relates to public health, and that's a generalist journal that often persons who are public health professionals will seek to read on and review on a regular basis. Technical reports, however, are what a lot of us do when we are persons who manage, design, and implement programs in our respective community-based organizations. So technical reports often state how the problem was solved or how we went about recommending solutions. It's not published in a peer-reviewed journal, and they're written for a specific audience. And the language for this specific audience is so specific that a lot of times in technical reports, you see acronyms, and if you are not in that field, you probably wouldn't understand. If you've not been in DC long enough and don't know all of the various, we call it alphabet soup here, where there's so many agencies that we just have a number of letters to describe them. In technical reports, you can use the language that is literally within your field. You can communicate that way because the person that reviews the technical reports is an individual that knows this language and can interpret it as such. They are persons who are in the field that you're in, and that's who we submit our technical reports to. So what must be included in your narrative report? So I'm using narrative and technical reports interchangeably as the same thing. So using your project's performance objectives as a template. As mentioned, when you take a look at what you originally submitted, you have that and you have your work plan. In these two items, you have your process, outcome, and impact of your said evaluation. All of those items in that work plan were documented such that the objectives should be pretty easy to identify. Right now, it's just a matter of, did you accomplish the activities that you plan to accomplish during the reporting period? This could be part of the process. Again, part of the entire picture of, did you do what you said you were going to do? So we need to know first whether or not your project activities were completed during this period. And then we'll analyze in detail the goals met during the reporting period. So you have a list of activities, and then you will literally say, which of these activities have you been able to complete in the time frame allotted? Any goals for that period that were not accomplished, you'll note why these objectives were not achieved, and how this will affect the anticipated completion date of the project. So in this narrative, you get the chance to tell your funder or your program manager for the funding agency why you have not accomplished your goal. I mentioned that with COVID-19, there were a lot of goals where we may have had face-to-face interactions as one of the things that we wanted to do to reach our focus population. But with COVID-19, we were probably unable to get the number that we promised. And that would be one reason that you didn't achieve one of the project activities. So just keep in mind, they're not bad things. You just want to make certain that through the duration of your project that you documented everything that was going on, but especially for those items that you were going to miss, you want to be able to be very clear about why you did not meet your objective. And then note whether there is a need to revise the work plan, staffing pattern, or budget. Those could very well also be reasons that your activities may have not been met as a result of perhaps getting grant funding 4 months after awarded, and you were unable to do the work to get your focus population where they needed to be in terms of your work plan, which means that you had to revise your work plan and start 4 months later than what was initially proposed. So all of those things, when you are documenting your work, your program in general, you should have that at your fingertips. So some questions that are related to the purpose of the narrative include: who is the audience? Who is the group that will be reading or reviewing this report? How will the report be used? What are specific elements of the report? What is the explicit message or aim of the report? What are the key points you wish to communicate? What information will help make your findings understandable and needs to be collected prior to writing the report? So a really basic outline is the introduction, the background, the list of key points, the recommendation, conclusion, as well as the references. Narrative components differ depending on what your funding agency is asking for. So this is a very generic sketch or workflow that you will see of narrative components that really vary depending on who is funding. So for the most part, everybody wants a title page. Funders typically want a table of contents. People do not want to sift through a lot of documents. They want to go right to what it is they are looking for. There's an abstract or executive summary. Again, it depends on your funder. There's an introduction. There's a background and significance or literature review. There are methods. How are you going to do this work? Results are included in your narrative components, as well as discussion, conclusion, sustainability recommendations. Lessons learned are usually included in narrative reports. Some funders don't ask for it, but a lot do. And dissemination, again, some funders ask and some don't. So that's something that you want to consider when you have the persons at the table who are planning to write the narrative report. How are we going to make sure this is one cohesive document if there's more than one person adding to this writing? So your title or cover page typically describes the scope of the report in a few words, as well as the author. The author sometimes can be your CBO, or it can be the program manager and or project director of the project, the date of submission, as well as the name of the funding agency. So it very well may be DC Health, it could be Health HIV, it could be Health and Human Services, and sometimes they'll have a number that goes with it, your grant award number. That would all be on the title or cover page. in your table of contents, this is what I mentioned prior, is what you'll find are people in the agency that review your narrative reports prefer to go to their section of expertise. So if you have an evaluator that's reading your narrative, the evaluator will go to the table of contents and literally look for your evaluation or your methodology section, and that's what they'll focus on. So the table of contents is important because it provides the reader with a list of major and minor segments of the report, and it allows them to go and seek and find the section that is of most interest to them. So they don't have to go through 100 pages. Instead, they go to the section of interest. It indicates also how the information is organized. And all tables and figures are included in the table of contents. So not just the actual report, but if you have a logic module, appendices, if you have all of those other things that you would like to add to your narrative, you should also include it in the table of contents under, appendix A through F, just letting the reader know that they'll be able to find all of these other items in the respective pages of the table of contents. The abstracts are always or typically written last, even though it's shown first. In the abstracts are typically 300 words or less. Sometimes your funding agency tells you the exact length that they prefer the abstract to be, but they typically do not exceed 300 words. It provides a concise summary of the complex research. So what was the problem? What was the problem researched? What were the data analysis methods? What were the results? And what are the recommendations? In some, you'll find lessons learned as well. And if we're looking at an abstract versus an executive summary is between 1 and 2 pages and tells the overall summary of the report findings. So it will often disclose the results, the limitations, all of that you can find in an executive summary. Again, your funding agency will let you know which one they would prefer. There are some funding agencies that do not request an abstract, but instead ask for an executive summary where an individual at a higher level, perhaps the program officer's superior, will ask for this executive summary for your agency, which shouldn't exceed 2 pages. Most of the executive summaries I've seen to date are typically 1, and they include what the actual problem was, who the audience was, as well as what the results of the intervention was and how we could possibly scale up or the limitations you will find in an executive summary of 1 to 2 pages. So your introduction is the first thing that a lot of us read. It sets the tone of the report. It states what the actual problem is. It lets us know the purpose of the narrative as well as the scope of the narrative. So depending on when your reports are due, you have a final report, you have a quarterly report, you have a mid-year report. All of these are contingent upon what your funder is asking for. The reporting structure will vary from agency to agency. So the scope of the narrative, if it happens to be a quarterly report and it's based on the data that you've collected from perhaps January through April, then that's what it would be reflective of. So you would state that in this report, that this report is from the period of January to April 2020. And usually on that title page, you would also mention that this is a quarterly report versus a final or annual report. So the background is stating the limit of the review. It's typically a broad topic with a historical background and or specific limitations. What we have is the issue or the challenge of HIV in a particular community. And the focus topic, when we look at the topic in said community, we make it even more narrow by focusing or honing in on a population specific to that community. So we can probably look at men who have sex with men as a subpopulation of a larger population in a particular ward in the city. And what we are hoping to find through our intervention is filling in the gaps in knowledge for this topic. So if we notice that in our communities, there's something that is lacking in services or in knowledge for men who have sex with men, our organization seeks to fill that gap. And that's what you're writing about in the narrative report. In our proposal, we noticed a gap in the men, among men who have sex with men in Washington, D.C. We hope to fill this gap by doing X. And that is what essentially you are describing in your narrative report. The reason that you have decided to intervene in this manner is because the background literature that you have researched said that this is an untapped area, or this is a place in the grand scheme of knowledge that has not been addressed yet. And you hope to design a program that will be more reflective of Black men who have sex with men in Washington, D.C. So you transition from a review to the purpose of the reported program activity. Our job is to fill the gap in knowledge, skills, or attitude. And we know this because in our research, we saw that there was an unmet need in this population. So your methodology is used to judge the validity of the research. Sometimes you need institutional review board approval. So in the university setting, we call it the IRB process. That is always necessary when you are working with human subjects. And the IRB process is really to protect the individuals that we work with. At no point in time do we want individuals to feel that they have to comply with us. They should always know in any kind of research that we're doing in the community that they have the right to opt out. Community members should not feel coerced into any program at any point in time. The IRB was placed in effect, especially in universities and hospitals, et cetera, to make certain that we are not taking advantage of the clients that we are supposed to be servicing. Study design, again, how are you going to collect the data? Sampling, where are you getting this data from? Who are your people? Who are the people that you'll be working with? The setting, where is data collection taking place? Note, when we evaluate, we like to talk about meeting clients where they are. So we want that setting to be especially beneficial to the client. We want them to feel like they have some sort of power and or control, which is why in the methodology, we want to ensure that we are able to meet them where they are, and setting and context are very important in the methodology. In your methodology, you would also note whether this is a pilot test. Is this the first time something of this nature has been done? Is this the first time that you're using an evidence-based curricula, but that evidence-based curricula may not have been used in the population of Black men who have sex with men? So because of this, what is it that you will be contributing as a result of this pilot test? How will you contribute to the body of knowledge as a result of this pilot? So remember, pilot tests are often things that haven't been done before in said population. And by you doing that, you will be working through the methodology on a smaller level that ideally you hope to scale up to once you see how your intervention worked. So in your results, you're looking for the data and analysis portion where you may use a statistical program like SAS or Stata or any of the number of qualitative and quantitative methodologies that one can use. There are data packages for all of them, and if you hire an external evaluator, they will be able to do that for you. Or if you have an internal evaluator, that their job is literally to evaluate every program you have, you'll also have that person on staff, and they can help you with how to tell your story best. And then other results are referred to the response to research questions or gaps in service. So what does this mean? What are we answering as a result of our intervention? So description of the analysis output. One of the things that happen to be most helpful when we talk about our narrative reports is if you're able to use any sorts of tables or figures that help the reader to visualize what it is your clients have experienced, or visualize how your program may have been efficacious based on the way you've written, but also based on what has been presented in the table, graphs, and figures. So in your discussion, conclusion, and recommendations, we have a really robust section that can make or break your report, right? So remember, the report is the story that you are telling based on your intervention. You've designed this program, you were awarded the proposal, now you've designed a program and implemented a program in the population, and the hope is that we have learned something that we didn't know prior, and we have also accomplished our goals and objectives. So the first thing that we want to do in the discussion is defend or refute the literature limitations. So one of the things, if you recall from that background and significance, is that we wanted to address the gap that we found among Black men who have sex with men, because the literature at some point didn't include what you saw to be a challenge in your population, in your community. So in the discussion portion, you have the option now to say, well, based on the literature review, it appears that these are the challenges. I can confirm that these are the same challenges that men, specifically Black men who have sex with men, they are encountering the same challenges that was described in the literature. That's one. Or you can say, based on my population of Black men who have sex with men in Washington, D.C., they don't have any of the other challenges that I found in literature. As a matter of fact, I've noted that in my population, these are the challenges that Black men who have sex with men in Washington, D.C. have. And right there, just because, you know, this is a group that is often studied, you're contributing to the body of knowledge because you are highlighting what is the challenge, or what are the challenges that Black men who have sex with men in DC encounter. So in the discussion, really use that time to highlight your population in a way that grows the body of literature, increases the body of literature, but also informs the funder that we may need to consider diversifying our funding, or looking at other partnerships that can really hone in on issues that are relevant for Black men who have sex with men in Washington, D.C., versus what you had read or what you had studied previously in your literature review that say something completely different. So in this era of inclusivity, we want to make sure that everybody's needs are being met, and the discussion portion offers that time for you to highlight that you may see differences already in your population, and you want to move forward with how to continue that discussion. In your conclusion, you typically have a final brief interpretation of your results, and these results are what comes out of your evaluation based on your program design and intervention. And it worked, it didn't work. And why didn't it work, or why did it work? And then you go into your recommendations. So now that you know that the literature said this, you found this out from your results, with your brief interpretation of the results, what are you recommending? If this is a quarterly report, how does it differ from a final report in terms of what you're recommending? Well, if it's a quarterly narrative report and you are granted this funding for at least a year, what you can do is talk about what you plan to do going forward in terms of direct suggestions or action items. So your recommendation, if we're using a quarterly report as an example, your recommendation could very well be that given the first quarter of the year, you were unable to get the number of Black men who have sex with men that you needed in your focused population due to COVID, perhaps you can do something new in the virtual experience to engage these men about knowledge, skills, and attitudes around HIV prevention, right? So if it's quarterly, you can talk about these action items and suggestions that you would want to incorporate for the next quarter. If it's a final narrative report, you could also consider this idea that in this final report, you have data and you have information for, let's say, the course of a whole year. The goal is always to scale up. We always want to discuss sustainability, but we want to make certain that the way we tell our story leads the funder to believe that while things went relatively well in this iteration of the work, there is still more work to be done. What we could do if we had a little extra money and more time is this. We could plan a more robust program in the hopes that there's not going to be another COVID-19 in 2021. We could promise or suggest or recommend that we get a number that we wanted to get, and we would partner with more organizations so that we would have sustainability through the years. We would build better partnerships and really work on the sustainability factor going forward. And then in lessons learned, I think it's just one of those things that happen to be so important when we discuss the limitations of our project, as well as what we learned in the grand scheme of things. So the reason that I think lessons learned is so important is a lot of times when working with hard to reach communities, we find that we sometimes don't deliver what we'd like to, because we forget that these populations have a number of competing factors, right? They have social determinants of health issues that we didn't include when we thought about our program objectives and or activities. If somebody doesn't have housing, they're unlikely to make it to your group session, right? So talk to your funder, discuss with your funder what the greatest strengths of your program happen to be, as well as the most important concerns that are apart from finances currently facing the program. So one of the things that I would continue to highlight is this idea of building community resilience and noting that populations that are hard to reach, which include most of our focus populations, are usually the populations that have more challenges within the social determinants of health, right? So we want to provide the funder with this information, like, we had the best intentions. However, these competing factors continue to be a challenge for this population. We would like to see the numbers of HIV decrease among this population, but without linking to care, without a primary care physician, without housing, it makes it that much more challenging for us. That's one side of it. The other side is, what could be the greatest strengths of the program? What are some of the things that we want to brag about that we did really, really well in the program that maybe other people would like to follow after us and try out what we did because it worked so well? I think one of the benefits of doing this work a long time is really being able to point out what those strengths are. When you work with a community and you build trust over time and you start to really look and approach the entire community from a strengths-based model and no longer a deficit model. So regardless of the fact that these communities may be underserved, there's still a community that can teach other people things, that can create their own ideas, that know how to reach their populations better than anyone else does, that's for sure. But because we are authentic and culturally sensitive providers, our greatest strengths come from the fact that we have built a relationship based on trust and cultural humility among these populations. And as a result, these populations are more than willing to work with us over time. And that is a strength, because when we're talking about reducing health disparities or achieving health equity, understanding that it's a strength of your program to have these authentic relationships and have the community own what the issue is around HIV and really become innovative with how they plan programs. That could be a strength of your program. And you want to highlight that lesson learned, because oftentimes people utilize a deficit model and don't find enough positive things to write about communities that are often underserved. So then how do we disseminate this information? How do people learn about the work you've been doing? Because when we're funded for, a year-long grant or even a 3-year-long grant, the grant comes and the grant goes, and we're so focused on reporting. One of the things that we don't do very well is disseminate our information. What is it that we learned as a result of this project? Your narrative, again, is a story where you get to highlight all things fabulous about you, all things fabulous about your community-based organization and the work that you do in your community. So stakeholders, remember, we have the stakeholders engaged from the very beginning. How do they learn about the work that you do in the community? How do you disseminate to them? Is it via social media? Is it via newspapers? Or how are your stakeholders engaged? How are your populations reached? You want to make certain that everybody feels like they own a part of this, that everybody feels like they are able to contribute, which is far more powerful when we talk about any sort of community work and or engagement. And then your dissemination. I mentioned that a little earlier, this idea of really forming effective partnerships as a recommendation, noting that when using the example of COVID, if that is a reason that prohibited you from acquiring your numbers, that we want to be very clear the next time around that we have the right partnerships at hand in the event something else happens. In the event there's a surge and there's another round of infections and we are already working in a high-risk population. Who are the individuals or organizations that we can partner with so that the ball doesn't completely drop when we have to report, right? So we still want to achieve our goals and objectives, but we need to make certain that we have effective partnerships in order to do so. And we also want to demonstrate to funders how we'll leverage the resources for sustainability. Because as the funding gets smaller and smaller and the pot gets smaller and smaller, we have to use these partnerships and we have to figure out how to scale up with less. How do we do more with less? It's going to include partnerships. It's going to include this virtual space, these Zoom platforms that we're now on. We're going to have to really be creative and thoughtful when we think about how we want to disseminate our information. Even if it's going to be via social media, Twitter, Snapchat, TikTok, what are we going to do to let our stakeholders and populations know that we are in it for the long run? We are not going to desert you because the funding has ended. Thank you. How about thanking our populations verbally for providing us with this sensitive information that will hopefully help the greater community at large? But the first thing we need to do is let them know that we have completed the work we're doing, or we're currently trying to get funded to do more work. So that communication is extremely important if we want to continue the work that we are doing in that population. So here are some writing tips that I think could be very helpful for you when you are writing your narrative. Ensure the writing is in plain English. You really want to be grammatically correct, and you want to have a cohesive document, which is why you need to write succinctly. I think one of the things that we mentioned in the beginning is that we need to identify who is going to be writing the narrative. Because if it's one person writing the narrative, it should be pretty cohesive. But any time that we have more than one person writing different parts, it can become unwieldy. So we want to make certain that we're on the same page in terms of what the messaging is going to be, and that the writing is clear and free from jargon. No colloquialisms should be in this writing while you're speaking to an expert in the field, which is fantastic. So you're able to use a lot of the acronyms and you're using language that's specific to that field. You don't want to have any slang, any jargon that will distract the reader from what it is that you are trying to say. You also want to answer the questions specified in the template. So most funders give you some sort of rubric or template for what your narrative quarterly should look like, your mid-year, your final report. So they've told you what it is that they want. All you need to do is answer the questions. I would suggest that having one person, like the program manager or the project director, writing the entire document to be the best advice. They can get pieces from you, but we want it to sound like one voice, right? So even though you may have written your section up on the methodology for your project director, and the evaluator has done his or her data portion, we want to make certain that it sounds like one voice and that the reader is not confused when they read it, and that all of the questions are answered. Because another thing that happens without a template is that people just write a little bit of everything and that's not necessarily what is being asked of the individual. So we want to be clear about adhering to the questions specified in the template. In terms of references, when we are utilizing work that's not ours, APA is most often how we cite sources. MLA is also commonly used to write papers, and your appendices is always at the end of the report, like your survey and your marketing materials, etc. In conclusion, narrative reporting provides a time to highlight the success of your program. It allows organizations to assess their programs and make changes. Narrative reporting also allows organizations to utilize programmatic knowledge to scale up. I think that one of the greater benefits of this narrative reporting is really helping you to track how well your program is doing. So similar to this idea of continuous quality improvement, the narrative that you are providing your funder is letting your funder know that you are complying with your grant deliverables, not just because it's due, your report is due, obviously, but because you are answering the questions in an affirmative manner that suggests to the reader, to the funder, that you are complying with the grant. When you do this well, when you turn in these reports on time, as suggested, and they are written in a manner that is easy to understand and free from jargon, it makes your funder and or project officer very happy. And that's what we want to do. We want to keep our funding stream, our superiors, very happy with our writing and our adherence to our grant deliverables. Narrative report writing is one part of that, and doing that well will only lead your organization to better success in the future. Thank you so much for tuning in today, and I am here to receive your questions afterwards. Have a good day.